COVID-19 continues to be a rapidly changing situation for all of us. Hegg Health Center is here to keep you up to date on the latest things happening in Rock Valley. Here to join me is Chief Medical Director, Dr. Jonathan Ingvers. Thanks for joining me. So there are many ways that Hegg has had to adjust how they care for their patients. Can you touch on some of those?
Well, we've already been decreasing a lot of the non-essential visits for several weeks already. And just recently I've implemented doing virtual visits. So we now have a platform called Avera Now that patients can download on their phone or a tablet, and we're able to communicate them online without the need to come into the clinic. We do continue to offer face-to-face visits if needed, but we ask that the patients call the clinic and we'll direct them to the appropriate service for the need that they have.
Perfect. There have been a lot of mentions within the media of hospitals having a shortage of personal protective equipment, or PPE. How is this being a new concern being handled within Hegg?
We've been trying to proactively order and work with Avera and some of the other suppliers to make sure that we have enough PPE available to keep our staff safe. We've also postponed or canceled some of the elective surgeries, trying to minimize unnecessary use of gowns and masks. And we're also very thankful for the community support in making the cloth masks that allow us to conserve our own stores of protective equipment, and that will prolong the life of the equipment that we do have. So just trying to be very mindful about how we're using the equipment and also proactively ordering it and working with suppliers.
Great. We know that 80% of COVID-19 cases are able to be treated at home. If someone does have COVID-19 or even all of the symptoms but may test negative, how do they properly recover at home?
The most important thing is to remain isolated. So if you're going to be at home with family in the same house, trying to limit contact between family members so that no one else gets the virus. The best way to do that would be staying in a single bedroom, using a separate bathroom if possible. And then the care for the virus is mainly supportive, so continuing to eat healthy, continuing to treat symptoms with, for instance, Tylenol for fever, and drink plenty of fluids. Usual things that you would do for any virus. Right. And then if the symptoms are worsening, particularly if there's more shortness of breath or any sort of respiratory distress, we would recommend contacting the clinic or the hospital with those concerns, and we can get you directed to the proper clinic or ER as needed to provide services.
Okay. We've all heard social distancing in one way or another lately. How is that being implemented around here, and why is that so important?
Well, the virus spreads through respiratory droplets, so anyone who has been infected, whether they have symptoms or not, can spread the virus through coughing, sneezing, maybe even talking, and then a non-infected person inhales those droplets into their lungs and develops an infection. Can also pick up the virus through surfaces, so if you touch a surface that has the virus on it and then touch your eye or your mouth, you could also become infected that way. The biggest problem with this virus in particular is so many people have minor or mild symptoms and may not know it, so that could be spreading it to others without being aware of it. So social distancing is important in that respect, generally staying at least 6 feet from other people to limit the droplet spread, but ideally even more than that. Avoid gathering in groups, just staying in contact with your own family members if possible, and nothing beyond that.
Is there anything else that you feel is important to share, particularly about this virus for the community?
Well, I'd just like to thank the community for their efforts so far. I think we've done a really good job of social distancing and supporting each other through this virus, and as a result, we haven't seen a lot of it so far. But I'd also just like to encourage everyone not to let up on social distancing, especially this Easter weekend. Try to enjoy the weekend, but I'd encourage people not to gather together as groups outside of their immediate family. Enjoy an online worship service, or communicate with their family through FaceTime or other online platforms. But just keep up the good work, and hopefully we can avoid any surge of this virus.
Great. Thank you so much for this guidance and advice, and thank you to the community for, again, following these recommendations that we have continued to share. To learn more about COVID-19 or to view other resources, you can visit hegghc.org.